Let me tell you about Walter, 67 years old, spent 45 years working construction and farming land outside a small town in Illinois. Hands like leather, never missed a day of work in his life. Walter came to see me because his wife finally convinced him to get a checkup he had been avoiding for 3 years. He sat down, and before he said a single word about why he was there, I looked at his feet. What I saw on Walter's feet that day told me more about what was happening inside his body than any conversation we could have had, and it told me we did not have much time to waste. I am going to tell you exactly what I saw and what it meant as we go through 7 signs your feet can show you right now. Walter's story does not end where you think it will. Stay with me to the end because what happened to him next is the reason this video exists. Before we continue, if this kind of real, honest medical information matters to you, hit subscribe and tap that like button right now. I'm Dr. Arthur Sterling. Here is something most people never think about. Your feet are about as far away from your heart as any part of your body can be. That means they are the first place where circulation problems show up, the first place where nerve damage becomes noticeable, and often the first place a serious internal disease announces itself, long before a person feels sick anywhere else. Doctors are trained to look at a patient's feet early in an exam for a reason. The feet often reveal diabetes, heart disease, and circulation problems before any blood test does. Walter had spent decades on his feet, in work boots, in fields and on job sites, telling himself that aches and changes in his feet were simply the cost of hard work. That belief is exactly what delayed him for years. As I examined his feet that day, I started noticing things, one after another, that had nothing to do with hard labor at all. The first thing I noticed on Walter's feet was discoloration. Not bruising from work, not dirt, not callus, a dusky, slightly purple-red tone across both feet, worse on his toes, that did not match the rest of his skin. When the skin on your feet turns dusky red, purple, or pale white, especially when your legs are elevated, it often means blood is not reaching your feet the way it should. This is called peripheral arterial disease, narrowing of the arteries that carry blood down to your legs and feet, frequently caused by the same plaque buildup that causes heart attacks. Walter told me his feet had looked a little off for over a year. He thought it was poor circulation from standing all day, something he had simply lived with. I asked him to lie down and elevate his feet for 2 minutes. The colour did not return normally. That single observation moved his case from routine checkup to urgent. Then Walter mentioned something almost in passing, the way patients often do with the thing that matters most. A small cut on his right foot from a piece of metal on a job site that he got 8 weeks earlier. It had not healed. He had been putting antibiotic cream on it and a bandage, assuming it simply needed more time. A wound on your foot that has not meaningfully healed after about 4 weeks is one of the clearest warning signs of diabetes or poor circulation that a person can have, and it should never simply be given more time. Slow wound healing happens because reduced blood flow means less oxygen and fewer healing nutrients reach the injured tissue, and elevated blood sugar interferes with the entire repair process at a cellular level. I asked Walter when he had last had his blood sugar checked. He could not remember. That wound, sitting quietly on his foot for 2 months, was the second piece of a picture coming into focus. I asked Walter to close his eyes, and I touched different spots on the bottom of his feet with a simple filament, asking him to tell me when he felt it. Walter could not reliably feel the filament touching the bottom of either foot, a finding called peripheral neuropathy, and one of the most dangerous diabetic complications precisely because it removes your built-in warning system for injury. He had been stepping on rocks and debris at work sites for months without fully feeling it. This is exactly why diabetic foot wounds become so dangerous. When you cannot feel pain normally, small injuries go unnoticed and untreated until they become severe. Walter told me his feet had felt asleep, on and off, for at least a year, something he attributed to standing on hard concrete all day. It was not the concrete. His nerves were already being damaged by something his body had been dealing with silently for a long time. By this point in the exam, I asked Walter to remove his socks completely, and what I saw next added another piece. Both of his feet and ankles were visibly swollen, the skin slightly shiny and stretched, with an indentation remaining for several seconds when I pressed gently on his ankle. Swelling in both feet that leaves a lasting indentation when pressed can signal heart failure, kidney problems, or liver disease because fluid is no longer being managed properly somewhere in your body. Walter said his boots had felt tighter by the end of every workday for months, and he had simply bought a half size larger. He had never connected that to anything beyond getting older. Combined with what I had already seen, the discoloration, the unhealed wound, the numbness, this swelling told me Walter's body had likely been compensating for something serious for a long time, and his feet had been trying to tell him the entire time. I looked closely at Walter's toenails next and noticed they were thickened, yellowed, and slightly lifted from the nail bed on several toes. The skin around them was unusually dry and cracking in a way that went beyond simple dry skin from work. Thickened, yellowed toenails, combined with unusually dry, cracking skin on the feet, often point toward poor circulation or uncontrolled blood sugar, conditions that quietly change how skin and nails are nourished over months and years. Walter had assumed this was simply fungus from years of work boots, something cosmetic he had never bothered treating. In isolation, it might have been just that. Combined with everything else I'd found on his feet that afternoon, it confirmed what I already strongly suspected. And I told Walter we needed blood work immediately, that same day, before he left my office. Walter's blood work came back the next morning. His fasting blood sugar was 287. His HbA1c, the 3-month average, was 11.2%. Walter had type 2 diabetes, almost certainly for years, completely undiagnosed, because he had never gone in for a checkup and had explained away every single symptom as simply the result of hard work. An HbA1c above 6.5% confirms diabetes, and Walter's 11.2% meant his blood sugar had likely been dangerously elevated for years, silently damaging his nerves, his blood vessels, and his feet the entire time. This is the sign I most need you to hear, even though you cannot see it on his feet directly. The other 6 signs are often the first visible clue that this 7th, hidden problem exists. Undiagnosed diabetes frequently announces itself through the feet first, through wounds that won't heal, numbness, discoloration, and swelling, long before a person ever has a reason to suspect their blood sugar. Walter looked at me and said the words I hear far too often. I just thought I was getting old. Here is where Walter's story turns and why I wanted you to stay until the end. Because Walter came in that day, because his wife pushed him to finally go, we caught this early enough to act. We started him on medication to bring his blood sugar down immediately. We referred him to a vascular specialist for his circulation, who confirmed peripheral arterial disease that was treatable, not yet severe. The wound on his foot, once we controlled his blood sugar and improved circulation, finally began healing within 3 weeks under proper wound care. 8 months later, Walter's HbA1c had dropped to 6.8%. His foot wound had fully healed, and his vascular specialist told him his circulation had measurably improved with treatment and the walking program we built together. Walter still works his land. He still has calluses like leather, but now he checks his feet every single night, something his wife reminds him of, and something that likely saved him from an amputation his vascular specialist told him he was genuinely at risk for within another year or two if nothing had changed. Walter's feet were trying to tell him something for years before anyone listened, including Walter himself. How old are you? Write it in the comments right now, because the conversation about your feet at 55 is different from the conversation at 75, and I want to know who is watching. Tonight, take off your socks and actually look at your feet. Check the color, check for any wound that hasn't healed in a month. Check for numbness, swelling, and changes in your toenails. If you notice even one of these 7 signs, call your doctor this week, not someday. If Walter's story moved you even slightly, please hit that like button right now. It takes 1 second and it helps this reach someone whose feet are trying to tell them the same thing his did. Subscribe so you do not miss what I cover next. And share this with someone you love who has been explaining away changes in their feet for far too long. I'm Dr. Arthur Sterling. The system profits from treating diabetes after it has already caused damage. I profit from making sure you catch it while your feet are still trying to whisper, before they have to shout.